Good morning or good afternoon, depending on where you are in the country. I want to thank you for joining us for this technical assistance webinar for the G08 program within NLM. The title of the grant program is called the NLM Information Resource Grants to Reduce Health Disparities and Promote Health Equity. It's quite a mouthful, but there's a lot of ideas in there. I'm going to try to abbreviate my saying it by calling it G08 more often. I'd like to give you just a quick overview of what's to come during the webinar today. First, we'll do introductions of the speakers and panelists. We'll talk a little bit about the logistics of the webinar itself. Then we'll get into the background and overview of the funding opportunity. We'll talk about what NLM is interested in, what the Office of Research on Women's Health is interested in. Then we will move on from presentations to talk about the review criteria and how the scientific review process goes, followed by grants management and budget. And then we will finish by having a Q&A session. I first would like to make some introductions. My name is Becky Moen. I am a contractor with the program unit within the Extramural Programs unit within the NLM. I would like to introduce Dr. Ali Sharma, who is a scientific review officer, and Andrea Culhane, who is our Chief Grants Management Officer. Also joining us today is Dr. Elizabeth Barr from the Office of Research on Women's Health, where she is the Associate Director for Interdisciplinary Research. Just a few things about the webinar itself. The webinar is being recorded. We will be distributing a link to the recording, slides, FAQs after it's done. Just to keep the webinar sort of moving smoothly, the attendees are muted and are unable to unmute themselves, but you are able to submit questions through the chat feature. And we will do the Q&A session after all of our presentations. So this notice of funding opportunity is PAR 24-281 is actually a renewal of a program that has been going on for a long time at NLM. And it's a really unique funding opportunity. We'll talk a little bit about the history, but this grant is a resource grant. It's not a research grant. And what we are looking for with these grant applications is new resources and services that help populations that are experiencing health disparities, or the healthcare providers who are serving the populations with health disparities. The program supports the development of resources that can be used to improve health and well-being and that lead to reductions in health disparities. Ultimately, NLM has a goal of reaching more people and in more ways. And it's important that that information is accurate and understandable and is empowering to populations specifically that are experiencing health disparities. We all know that misinformation and disinformation are common these days. What we are looking for with the G08 is to deploy new information resources and services and putting research knowledge into practice. It's important that these grants, that these programs, that the resources that you are developing are tailored to meet the needs and that they are based on evidence. Of course, since we are NLM, the National Library of Medicine, we encourage the use of new ways to use information technology. And once again, we emphasize how important it is that the information that we are sharing and using is accurate and unbiased. Just a little bit of history. The The GO8 program was actually developed in response to US Code 286B, which was written in the 1940s. And if you look at the little snapshot on the right-hand side, you can see the actual statute that provides the legislation for this program. We don't have all of the records, or at least I don't have access to all of the records going back to the 1940s, but I could find information going back to 1971, so 50 years ago or so. And since then, NLM has awarded more than 1,400 GO8 grants. Uniquely, NLM is the only IC to use the GO8 mechanism. And when you look back at some of the old grants, they were initially used to improve library services, which I think is interesting. An example that I pulled out from 1985, the goal was to raise the level of computer competency of health professionals at blank university. You think back, for those of us that were around in 1985, we didn't know how to use a personal computer. Even health professionals didn't know how to use a personal computer. So that's what this program was for. Times have changed, and a more recent example from this past fiscal year, or this coming fiscal year. The objective of the proposed project is to enhance, localize, and test a new free mobile app designed to provide reliable shared reading guidance and resources for parents. Somebody back in 1985, if they read that description from today, wouldn't even know what that meant. So it's kind of, I find it kind of neat that this program has been in existence for such a long time and now has such an opportunity to contribute to health literacy. There are three important requirements that go along with this program. I'm not going to read through all of this text. The majority of the text in these slides comes directly from the Notice of Funding Opportunity. So I highly encourage you to read that NOFO over and over and over again to help solidify exactly what the opportunity is looking for. Here I will summarize: scalable, sustainable, generalizable, right? We're looking for projects that are not just one and done and over. We want these, we want programs that might be able to be used in other ways, in other communities, and that are generalizable. The second requirement, it must be for communities or the providers for those communities that experience health disparities. The third requirement is that you must have evidence of a collaboration with a medical or health library. Since I've been working on this program, we've had a few questions about what constitutes a medical or health library. It's better to be very stringent in working with folks that are part of either the Medical Library Association or the Association of Academic Health Science Libraries. Those folks have specialized resources, specialized methods, and ways of helping access communities. So, and the other point that I would make on this, the collaboration with the library needs to be a real collaboration, not just a check the box that, yes, you've involved somebody. The reviewers are looking for true collaboration. I'm going to bounce back up just for a second. I've included a link here that talks about minority health and health disparities, and it has definitions. If you have questions about whether the population that you are focused on fits into that category, please check there. And if you are still wondering, please contact me as the program contact, and we can talk about it. Next up, I am going to hand off to Dr. Barr from the Office of Research on Women's Health. She's going to cover a few items related to the office.
Thank you so much, Becky. And on behalf of the Office of Research on Women's Health, we are delighted to be participating in this really exciting and historic funding opportunity. Thank you for sharing those additional details about the history of the G08. And so in the Office of Research on Women's Health, I'm just going to go through very quickly some of our priorities. If you could go to the next slide. Thank you. So the Office of Research on Women's Health was established in 1990. We're approaching our 35th anniversary next year. And we are a part of the Office of the Director at NIH. And so we work collaboratively with the 27 institutes and centers to support those institutes and centers as they consider women's health in the context of their own unique mission. We're also tasked with ensuring the appropriate inclusion of women and underrepresented minority groups in clinical research and promoting career advancement for women in health research careers. And our efforts are aligned with the NIH vision of a world in which sex and gender are integrated into health research careers. What's important for this funding opportunity is that the Office of Research on Women's Health does not directly fund grants. So we co-fund anywhere from $1 to 100% of meritorious applications, and we can only do that in partnership with our institute and center colleagues. You can go to the next slide. Just this year, we released the new 2024 through 2028 NIH-wide strategic plan for research on the health of women, which is another mouthful. And you can take a look at the full strategic plan with the link shown on this screen, which is nih.gov/women/strategic plan. And I really wanted to highlight some of the strategic goals that are particularly relevant to the G08. And so the first goal, to advance research that examines the multiple factors that influence the health of women, is certainly aligned with the G08 and the dissemination of resources. Additionally, the fifth goal, advancing community engaged science and thinking about ways to really broaden the engagement of communities in health research and dissemination. If you can go to the next slide, please. And so I encourage you to, in addition to reaching out to NLM, if you have questions as to whether your particular project is aligned with the mission and priorities of the Office of Research on Women's Health, please reach out to me. I'm always happy to talk about your project, but the final authority here is going to be NLM. And so you're welcome. Please reach out to me, but you will also likely direct you to reach back out to NLM. And I'm not able to stay for the Q&A, so if you do have specific cues, do follow up with email. Thank you so much, and back to you, Becky.
Thank you, Elizabeth. All right, I'm going to go back to sort of following through with the NOFO here. Eligible applicants, higher education, nonprofits other than institutions of higher education, local governments, federal governments, school districts, public housing authorities, Native American tribal organizations, faith-based or community-based organizations, and regional organizations. One of the things that I have found very interesting is that we get a lot of applications from sort of the non-standard, typical suspects, the usual suspects that always apply for research grants. We welcome that. It's a neat program that is available beyond just the traditional academic institutions. I do need to address that foreign components are not eligible to apply for this mechanism. Dr. Sharma will talk about this a little bit more, but I just wanted to put it out there that we do ask for a letter of intent. It's not binding, it's not required, but it does help us plan for the review activity. One thing to note, don't send your specific aims and ask for feedback on them to Dr. Wong, who's listed here. She is the head of the scientific review group. What she needs to know is just a general idea about what you are planning to submit. Now I'm going to get into a little more of the meat of the application. Despite the fact that it is not technically a research grant, we ask that you follow the research instructions in the How to Apply application guide. Just like with research applications, the main component of that is what's called the PHS 398 research plan. Within that, there are 4 major areas that you need to address. How you structure your research plan is really up to you. I've seen applications that are organized by their specific aims. I've seen organization by the review criteria. It really is up to you how you want to best describe what you want to do. But these components that we're going to go through in detail now must be addressed somewhere within the application. First up is the resource development strategy. This is a very long slide with a lot of words on it that I'm not going to read through every single one. We've talked about a lot of the key parts of this. Your project needs to be supported by published evidence, evidence-based products, and evidence-based theory behind the resource that you're doing is really important. There should be a rationale. Duh. You want to describe the features of your application of your resource in terms of why did you select this? What is the credibility of the source information that you're getting? Is the information current? Is it accurate? Is it complete? We like to see a user-centered approach to the development, deployment, and evaluation. That means that you are talking to the end users of this, and you're talking with them in terms of planning and developing how you plan to evaluate the resource. We would like to see how you plan to track the usage and the characteristics of the users. We've talked about the generalizability of the approach. We want to know how you are going to market your resource. We need to see a timeline and milestones. We'd like to see how you plan to sustain the resource. We absolutely want to see evidence that the community or population that you are serving has a commitment to this, that they have been involved in this, that they think that this is a good idea, and that they can imagine using it. And finally, we've talked about it, the collaboration with a library is absolutely essential. The next section that needs to be included is an evaluation plan. And at this point, I want to particularly point out that in the original NOFO, there was a mistake that the description of the resource evaluation plan was included in the section that describes the award terms. So it's sort of at the very end of the NOFO. And we published on October 11th a correction to that. The evaluation plan needs to be part of the PHS 398 research resource plan. So make sure that you note in the correction where the evaluation plan goes. The evaluation plan Typically, it needs to measure the value of the resource, the usability, what the user experience is like, how the proposed approach or resource can be used as a model for other organizations. We're looking for potentially baseline metrics, and how are you going to evaluate the short and long-term success of this resource? Obviously, we've talked about the user-centric design. We encourage you to get feedback early and often from the users. Please note that we will not accept an application that uses a clinical trial design for the evaluation. There will be human subjects involved because you will have users, but do not propose a clinical trial to help evaluate it. If you need more information about that, please contact me, the program office, and we can help you work through that. The third section that is required to address is the resource dissemination plan. We've talked about this. It's important that the resource that you are developing is not just a one and done, right? How are you going to share it? How are you going to get it out? How are you going to let others know about what you are doing? Including letters of support from the folks that can help you disseminate would be very, very welcome, as well as letters from the communities who are potentially going to benefit from the outcomes. We would love to see that. The fourth section is called the resource sharing plan. You're going to ask me, what's the difference between a resource dissemination plan and a resource sharing plan? Well, the resource dissemination plan is very specific to this G08 funding mechanism. We're looking for details for your specific application, your specific resource. The resource sharing plan is a standard section that goes with every NIH application. It is developed separately, and you will see that it is a separate attachment in the application process. This section can be a little more generic and general about sort of your philosophy, about how you see the sharing of resources in general. Maybe you have experience doing this before with other types of resources. This part does not need to be quite as specific to the exact resource that you are building. All right. Next up, I'm going to talk about what would be responsive and what would not be responsive in terms of NLM's perspective. Responsive applications might be developing or even upgrading health information resources. It might be resources or services to community organizations. It might be implementing innovative patient-centered care and precision medicine. And how do you do that? How are you developing novel information strategies for that? It might be developing new resources for communities that are underrepresented in clinical research, and you want to increase the number of folks that are participating, and so you are developing resources focused on that. Ultimately, what you are doing is identifying populations that have a disparity. You are developing resources that target that disparity, that are targeting the community, and trying to help give them information in ways that are tailored to how they will best respond to help improve health equity and decrease disparities. Non-responsive, obviously, applications that are not addressing a population that actually experiences health disparities. projects that don't include a library, an evaluation that meets the NIH definition of a clinical trial. We're not using this money anymore for installation of online library catalogs, or for EHRs, or for digitizing print materials. Those are old days, right? We also would not consider projects that duplicate existing NLM products and databases, as that also would not be responsive. If you are unfamiliar with the NLM products and databases, I highly recommend check out NLM's website. There's a lot of resources there that actually also can be helpful to you in your development of your resource. I'm nearing the end of my part of the presentation. I wanted to provide one recommendation, and that is to go look at the other types of grants that have been funded in the recent years. And you can find this by going to NIH Reporter and search on G08 and NLM, and you will come up with a list of projects that we have funded. You can read their abstracts and get a feel for the kinds of projects that we have funded historically. I will end my portion of the presentation with some key dates. The application receipt date, December 13th and counting. For applications received December 13th, the peer review process would happen in February. We'll go to the council in May, and new awards would not start any earlier than July of 2025. At this point, I will stop, and I am going to turn the presentation over to Dr. Ali Sharma from our review unit.
Thank you so much for the wonderful presentation and information. I'm going to start sharing my screen. All right, are you guys able to see my screen? Yeah. Okay, so I'm going to talk about, switch the gears, talk about what happened to your application and when it comes to the review. So how we evaluate and what was the criteria. Very general and broad overview of the review process. So this is basically going to be responsive to the section 5 of the PAR 2428-1, the NOFO, Notice of Opportunity. All the applications submitted to NIH are the support of the NIH are evaluated for scientific and technical merit through NIH peer review. And as Becky was explaining, please make sure that you have this PAR. The link is also here, and you can review that section 5. So the applications are evaluated based on the several important criteria. First of all, the overall impact. The definition of the overall impact of the application is the likelihood of the project exerting sustained influence in the field of, sorry about that, yeah. Sustained influence in the field involved in the consideration of the following review criteria and additional review criteria. So what are those specific review criteria for this program? They're including scored review criteria are including significance, investigator, innovation, approach, and environment. I'm going to go over one by one and explain to you what we are looking for. So for significance, there are some general questions that NIH asks for all the applicants to address. These are including, does the project address a critical problem or barrier in the field? Is the supporting prior research rigorous? Will the project improve scientific knowledge, technical capability, or clinical practice? Will successful completion change concepts, methods, technology, treatment, services, or preventative interventions in the field? And there are some specific questions to this notice of funding opportunity or NOFO that is all in the section 5, including, is there a focus on population that experience health disparities or those who provide health care for these populations? Has the information problem and its context been clearly stated? Is there evidence that intended audience can benefit from proposed information resource? To what extent does the proposed resource fill a gap or meet a need for those who experience health disparities and or those who provide healthcare for these population? And if the project is successful, how accessible would the resource be to the intended audience? Next, and then last one is, can the proposed resource be institutionalized or made available at a medical or health library or sustainably through an online resource? For the next part, that is the score, is the major criteria review is investigator. So the questions are again two parts. The first part is general NIH requirement questions that are the investigator team members, principal investigator, are well suited to the project based on experience and training. Do early stage investigator have relevant experience? If they are, if established, do they have a track record of advancing their fields, publication, etc.? Does the project involve a collaborative team with complementary expertise and clear organizational structure? And specific questions that we're asking for this NOFO to be evaluated is, does the expertise of the investigative team fit the goals of proposed projects? Is there a medical or health science librarian on the team, or does a team member have a library science expertise? To what extent has the investigative team partnered with community-based groups to develop and or plan disseminate health-related resources? Next part is regarding the innovation part. Does the application challenge and seeks to shift current research or clinical practice paradigms? Does it utilize novel theoretical concepts, approaches, or methodologies, instrumentation or interpretations? Are the concepts, approaches, methodology, or instrumentation novel in the field? And if it is refinement, improvement, or new application or theoretical concept, approaches, methodology, or instrumentation or innovation are proposed in the application? And also specific to the NOFO for the innovation part is, to what extent have the applicant proposed creative new strategies to meet the informational needs of groups that experience health disparities and or to those who serve these communities in some capacity? And to what extent is the approach generalizable for the other organizations that wish to undertake similar work? The next part is the approach. We talked about it a lot in the program, talked about that a lot, but there are several general questions. Are the strategy, methodology, and analysis appropriate? Do they address weakness and ensure a robust, unbiased approach? Are potential problems, alternative strategy, and benchmarks for success have been presented? Is feasibility in near early development addressed? Are biological variables such as sex considered for studies, human subjects? Are plans for protection and inclusion of the human subjects and based on the sex, gender, race, and age justified? And the specific for this notice of opportunity are how likely the user-centered approach to development, deployment, and evaluation to result in valuable resources? To what extent are representative of the target audience involved in the design and evaluation of the project? Are the content features of the information such as selection, source, credibility, currency, accuracy, and completeness carefully considered? Are there timelines and milestone proposed work appropriate? Is the plan for tracking usage and characteristic of users appropriate? Is the plan for promoting use of resource appropriate? Is the plan training users are appropriate? And is there plan for disseminating projects results are appropriate? And also, is there a sustainability plan for the resource or service after grant funding and is appropriate. And finally, evaluation plan is adequate or not. So for the environment part, there are several questions. Will the scientific environment in which the work will be done contribute to the probability of the success? Are institutional support, equipment, and other physical resources available to the investigator adequate for the projects proposed? Will the project benefit from the unique features of the scientific environment, subject population, or collaborative arrangements? And there are several additional review criteria. These are still scoring factors and will be put into the consideration, specifically participation of medical or health libraries. The question is, does the institutions demonstrate commitment to the needs of these who experience health disparity? And is a medical or health science library involved in this project? So there is a lot of emphasis in the medical health science library involvement. Pay attention to that for this NOFO. Is the context of coordination with a medical or health library and other information science experts adequate for the project? There are some additional scoring criteria, such as protection of human subjects. If there are human subject involved in the application, we want to make sure there are protection or involve exclusion, use of the inclusion of the women, minorities, children of age and lifespan. And the other part is resubmission. If you already have a GO8 and you want to, and you first round, you didn't get a good score and you want to apply again, that would call resubmission and or A1 application. And if you apply for the A1 application, the committee will evaluate the application as now presented and taking into consideration the responses from the previous scientific review group and what has been, whether it has been responsive to previous critics that has been mentioned in the previous summary statement. However, we do not evaluate the previous application, it's only the current form. These are will be not get separate scores, but they are all considered into the final overall impact score of the application during the review process. So there are several non-scoring factors or additional review consideration, although they are non-scoring, but they are still get evaluated and will get the feedback. Specifically, resource sharing plan, as you heard about it, and reviewers will comment on whether the resource sharing plan or rationale for not sharing the resources is reasonable. Finally, is the budget and period of the support. The reviewers will consider whether the budget and the request period of the support are fully justified and reasonable in relation to the proposed research. You will hear more about budget in the next presentation on the from the grant management. There are several hints that I would like to bring your attention to for the applicant. The letter of intent, follow-up of the NIH policy on hyperlink when you're writing, post-submission material, and then key dates for this round for submission and score report and NIH scoring scale and summary statement. So the letter of intent, as you heard before, we are not looking for a very detailed letter of intent. In fact, we're looking for a very brief descriptive title of proposed activity and only keywords, 3 to 5 keywords. The whole idea behind letter of intent is to identify the appropriate reviewers. Therefore, knowing the name and addresses of the principal investigator or investigator team would be extremely helpful, along with the name of the key personnel, to identify conflict of interest, and we do not invite people that are in conflict with the application. And of course, the name of the participation institution and the funding opportunity. So as I mentioned, the peer review is a confidential process, and it is important that the applicant do not contact the reviewers either before the review meeting or after review meeting. This is strictly prohibited according to the NIH. So there is an NIH policy for hyperlink. If you are writing your application, just pay attention that there are generally hyperlinks are only in a limited form are acceptable. Basically, those hyperlinks are typically limited to citing relevant publication in BioSketch, publication list, and it is not acceptable to have the other sort of hyperlink. The reason is because sometimes some of these URLs or hyperlinks may not be safe for the reviewer or may actually identify the reviewer if they click on that. So we are strictly prohibiting the using of the link. And if you need to add a link, we would ask you to type it down rather than have a link with the unknown link with the blue color that you can click on it. So the link should be spelled out, basically. We are also instructing the reviewers to, against reviewing the linked sites, to caution them from the, also could be a compromiser anonymity. And as I mentioned, it could be some sort of malware would be downloaded into their computers. So there are, although we have, once you submit your application, you cannot change to the material, but there are some exceptions to the after submission. There are some allowed post-submission material, including citation of newly accepted publication or patent. You can still add them. Revised budget page due to the new funding institution acquisition of equipment, for example. Updated BioSketch, for example, due to the replacement or loss of an investigator. Letter of support, collaboration due to the change in personnel. Adjustment resulting from natural disaster, if there is a loss of animal colony or loss of some resources or some natural disaster, you can submit that too. However, it's not allowed is correction of oversight or errors discovered after submission. That is not allowed. The procedure to send your post-submission material is all the materials must be approved by authorized organization representative, AOR, of your institution. And that person has to send it directly to the SRO, or if the material are originally coming from the PI or principal investigator, they should be have the AOR's approval in it, not just simply CC to the AOR and be directed would not be accepted. So there are several key dates for this GOA, this council round. The letter of intent due date is November 13th, which is a month before the application receipt date, as you heard it previously. The post-submission material is normally 30 days before the meeting, which is February 13th. For review meeting, date is March 13th. And scores would immediately, within the 3 business days, will be released, so by March 16th. And the summary statement, after the review has been done, will be released within a month, 30 days, after 30 days of the meeting, which is April 13, 2025. And with that, I'm going to leave my contact information here. I'll stay online after the grant presentation here too, if you have any question to answer the question. Thank you for your attention. I'm gonna hand it over to our grant management, Andrew.
Okay, thank you. Hello, everyone. Let me just share my screen. Great. My name is Andrea Culhane. I'm NLM's Chief Grant Management Officer, and I'm just here today to talk about the budget and one big change. So generally speaking, the application budget limit is up to 200,000 direct costs per year for up to 3 years. This limit does not, consortium F&A is not counted with this limit. So possibly the direct cost will be above 200,000 if you have consortium, if you have a consortium. Additionally, it's important to remember that the budget must reflect the actual needs of the project, and you'll submit a detailed budget and not a modular budget. And finally, the new thing this year with this application is that F&A indirect costs are allowed. And you can request F&A or indirect costs in alignment with your organization's NICRA, Negotiated Indirect Cost Rate Agreement, with the line for other supported activities for that rate. So it can't be a research grant rate. It's other sponsored activities rate. And that's all I have. So I will also be here if there's any questions about the budget.
Very good. I am trying to get my camera back on here. Ta-da! Only took me 10 minutes. Thanks, guys. So we will now open up for questions. And if you have questions, please put them in the chat feature. You have a few to start off with. The super easy question first is whether these materials will be made available to you afterwards. Yes. We will have both a link to the recording as well as our slides and documentation of the questions and answers that I will be sending out via email, and it will also be available on the NLM website. Now, the harder questions. So the first one is, can you share some examples of evaluations that are not designed as clinical trials? Yeah, absolutely. There's actually, if you Google academic evaluation, you can find all kinds of resources available, but evaluations may include interviews, focus groups, other types of qualitative data. It does not have to be that you have one, you have a group that uses the resource and a group that doesn't use the resource, and you're comparing the two, that will not be accepted, right? So find other ways to figure out whether your resource is doing what you want it to do, right? Ali, do you have any other thoughts on that you would put out there?
I think you covered it well. So
Fair enough. So I say to the person that asked that question, if you want to talk about this more, please send me an email, call me, and we can talk through that. The next question is another good hard one. I love it. You talk about generalizability at the beginning, that these should be for communities and should address different communities, but those ideas seem contradictory. To go deep in specific communities, incorporating their input and addressing their specific needs doesn't always lend itself for something that can be rinse repeat with another community. Can you speak to this, please? Thank you. Couldn't agree with you more. That said, say that you are working on a project to improve access to mental health resources for rural populations in, well, I'm just going to say Minnesota, because that's where I live. We develop a resource that allows for texting or chatting or Zooming with mental health counselors, that folks are able to access that kind of resource in a much easier way than they can right now. I might be able to say that, you know what, this worked in Minnesota. This worked in my rural farm community. I'm going to say, I want to see, and I'm going to try to generalize, maybe it might work in South Dakota too. I'm not talking about, that every single thing would need to be exactly the same. Are you developing a model that would be adaptable to another community that is similar to the population for which you developed your resource? And I agree with you 100%. The rinse and repeat model, what works for a rural community in Minnesota is not going to be the same resource for inner city Chicago, right? It's just not the same. But there are lots and lots of potential adaptable types of communities that you could adapt a model to other communities that are similar to the one that you've looked at. Again, if you want to talk more about it, call me. Next question. Are PIs who are considered early stage investigators considered? Yes, absolutely. Being an early stage investigator is always a benefit in terms of how your application is looked at. Zoe, okay, Dr. Wong is one of our colleagues, and it looks like she has a question.
Hi, good afternoon, everyone. Regarding the early stage investigator, NIH only apply that concept to R01 grant, does not apply to GO8. So
I beg your pardon. Then Zoe is correct. Yeah. I apologize. That is not, apparently that is not.
So you are now to get the benefit of doubt because you have now the definition of the definition of early stage investigator. Now the new investigator, right? What is the question is early stage investigator, right?
Yes, yes.
I'm sorry, I have to correct myself. Early stage investigator also about R1. About the person who has never received the R1 grant or NIH funding. Yeah. So that is actually, it is also applied to the R1. Ali, do you think so, Ali?
Yes, I agree with you. I think that is correct. And this is something, although the NOFO under the investigator it mentioned, if there is an early stage investigator, and whether it's been addressed their investigator status. So this is maybe something we can talk offline to clarify it and answer that to the audience better. We will definitely get back to the audience with more information.
The early stage investigator involved a time period, 10 years, from your last terminal degree, the highest degree, and then from the graduation year until your submission time, 10-year period. So there is a time frame. But for the new investigator, doesn't include age and then limit anybody who has not have NIH R1 grant. So it is complicated. I think for GOA, it is really not that relevant. Yeah.
Okay. We will follow up. We will do some more investigation and let you know via the FAQs that we distribute. Thank you. The next question is, if a resource is already in the development process, but not completed, can this be used to apply for the GO8? Yes. You're going to have to justify why it would deserve funding from NIH. You know, why, if you've already started it, why can't you finish it with that, you know, whatever funding or whatever resources you're using previously, you would have to make the argument, you'd have to make the justification that the GO8 would provide something unique or special and would actually be absolutely necessary to complete the development process. All right, the next question. Are the resource development strategy, resource evaluation plan, and dissemination plan included in the 12-page research strategy document, or are they separate documents? All three of those are part of the 12 pages, yes. There is a separate section called it's the last one I focused on, the resource sharing plan, which falls outside of the 12 pages. I hope that's clear. All right. The next question, can we do pre-post surveys to gauge knowledge changes after having exposure to the resources? Absolutely. Yep. That would not count as a clinical trial. Pre-post, if you're using the same people. Yep. Good example. Thank you. All right. Next question. Hello, our proposal to the previous announcement was not funded. We have been revising our proposal based on reviewers' comments. We know this is a new announcement. When we submit our revised proposal, will this proposal be considered a resubmission or a new submission? My reaction is that it will be considered a resubmission. You should include the reviewers' comments and your response to that. And it would be part of the introduction to the resubmission. Unless you completely change your application, then it could be considered a new application. Ali?
Yes, spot on, very correct. If it is within the scope of the original application, you're just responding to the reviewer's critics, then yes, we need to have an introduction page, which shows how responsive you have been to the previous review, and we will include that into as a A1 or resubmission application. We'll include it for the review purposes.
Good, thank you. Okay. Can the resources be developed during the grant or have to be previously piloted? No, you could develop them during the grant. That's partially what the money is intended for. So yes, I would say in terms of the applications that I have seen, I've seen both ways, right? Sometimes people have done a little bit of work and they've started to pilot it and they use the GO8 to build it out more or maybe extend it. Excuse me, or add new features or whatever. I've also seen where they've got a good idea. They need money to even develop the pilot test for it. So yes, and so it's both. Good question here. Does the resource have to be physically located at the medical library? Our concern is that the library is not normally considered a place where community gathers. Is it just that the resource needs to be developed by the library in partnership with the community and submitting organization? It's the latter. It doesn't have to be at the library. We want you to collaborate with the library, but the resource, like in the example that I gave, the resource is at home, right? It would be in people's homes. It's not, so no. Good question. And yeah, libraries are not always the place where everybody gathers, unfortunately, right? But good question. Can I put my email in the chat, please? Yes, I'll be happy to. And I will send it to everybody. Next question, I apologize if I missed this early in the session. Could applicants from land grant institutions collaborate with extension on an application? Absolutely, totally. Get a library though. Get your library involved. A health science library. medical library. But yes, absolutely. Next question. Does the library need to be local if such a resource does not exist physically in small rural areas, or can be partnered with a health science library? The world is very LinkedIn today, right? I don't mean LinkedIn as in LinkedIn. It has to be a health science or medical library. Collaborate with them from afar. I certainly understand what you mean by living in a small rural area. Yes. But I would, if it were me, I would collaborate with Mayo or with the University of Minnesota. I would find a way to collaborate with them. Not only do they provide a level of expertise and a level of sort of thinking that is helpful with this type of resource, they can also help with dissemination. So we talk about, okay, yes, we've built this model for a rural community in Minnesota. If I'm working with the University of Minnesota, they work with all of the other medical schools and population health science schools and other potential resources around the country that they can help disseminate, right? So there's lots of reasons and lots of possibilities for engaging with the larger areas. I didn't include this specifically in this presentation because I didn't want to go on a tangent, but the National Library of Medicine also has what's called the network of the National Library of Medicine. And it is organized by regions. And Google NLM and find which region you're in. If you don't already have a collaboration with a medical or a health sciences library, look online, look at the NLM resources and figure out which region you're part of and reach out to the NLM local site, the regional medical library. They can help you find collaborators. Once again, I'm showing my kind of nerdiness here, but it's a really neat program, and it's not very well known, and it would be good if it were better known. So that's another option. Okay. Oh, another good hard question. Is there a resource on how a health and medical sciences librarian is defined? Do they have to have a specific title and/or institutional affiliation, e.g. a librarian affiliated with a medical school or health sciences center? There is not a definition. My reaction is that the reviewers are looking for official health science librarians, people that work in a health science library or contribute to it in some way. There's not a specific title. But, and Ali, I don't know, maybe you want to respond to this, but when I read the summary statements, they're looking for that very sort of professional affiliation, not just me working with my local library at a hospital in my hometown, which doesn't even exist anymore. I think it's that academic and sort of libraries that are attached to medical centers and hospitals and that are part of the next generation of training those people. Ali, maybe can you?
Sure.
Yes.
You're right. I think that is the case, that it should be related to the medical or science library. And regarding the title, for the review purposes, we are trying to minimize the bias in the review.
Yeah.
Therefore, we're trying to not necessarily say if this is from the Harvard or Yale, or to
Right.
have a different noise or different specific value towards that. We are looking at the
Yes.
content of the application and the information, not just where it is coming from. And as long as it has all the criteria, all the training, all the experience, we all should review it equally for the reviewers.
The other thing is, justify your selection, right? If you said, we are going to work with this library and these people here, instead of going to, the biggest institution in the state, why? What makes that a good solution? And I think if you can justify that, if you can convince the reviewers that that is the right decision, it's not going to matter. Ali, would you agree with that too?
Yes.
So, that's a good question. Would a librarian who's designated friends of the NLM be a conflict of interest if selected as a collaborator? Friends of the NLM is a group of people that are friends of the NLM, right? And I don't know the answer to that. I really don't. I think it would, Ali would be a good person to contact for that specific question. There could potentially be a conflict there. So I don't know. All right. I have not shared my email yet, but I will. I've got another question. I'm already on the NLM Illinois State Advisory Group. Does that prohibit me in some way from partnering with a library in that area? Is there some type of conflict there? No. 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 If yeah, no, that's not a conflict. That's good. Okay. I think we've hit all of the questions. Oh, no, we didn't. Here's another one. The particular health issue addressed in our proposal is not a health issue unique to women, but women play an important role in the prevention on the health of the health issue in their household. Can we write it as responding to the mission of the Office of Research on Women's Health? Yeah. Yes. Absolutely. My institution is identified as a developing library member on the AAHSL site. I'm guessing that you're asking if that's if that counts. I'm going to say yes. And again, justify and convince the reviewers that it's the right way to go, and why you did, that this is what needs to be done and why we're doing it this way. So yes, I think that's perfectly good. Okay. Okay, one more. They keep popping up. The resources to be developed in our proposal are not available yet. We need funding to develop the resources, but we developed related resources for a previous project. The resources are in our team members' Dropbox. should we avoid including the drop? Yeah, no. The question is, should we avoid including the Dropbox link in our proposal? Yeah, no, you can't do that. That's just the same as a website, an HTML address. You can't do that. You get in trouble. Ollie will come back and say no. Okay. You guys, thank you for listening to us for so long and for your really, really, really good questions. I will be sending out the email with all of the links to all of the stuff. So you will all have my direct email address. And please do reach out, Ollie, for review questions. He's not going to answer the programmatic questions. Going to say, go to Becky. So if you have, programmatic questions, come to me. Review questions for Ali, budget questions, Andrea. And thank you. And oh, there was one other question about whether this if there's other cycles for this. Yes, there are other cycles. December 13 is just the first one for this round. There are other cycles. I can't think of what the dates off the top of my head, but there are multiple cycles for this one, for this NOFO. Okay. Thank you all, and best wishes. Bye.